Back pain is often blamed on age, hard work, or sleeping the wrong way. But in many cases, those are not the real cause. The biggest reason behind ongoing back pain is a combination of weak core muscles, poor posture, and long hours of sitting. When the muscles that support your spine become weak, your back is forced to carry more stress than it was designed for. Over time, this leads to stiffness, inflammation, and pain that can become a daily problem. Another common cause is poor posture. Looking down at your phone, working at a computer without proper support, or slouching on the couch places constant pressure on the spine. Even a few hours every day can gradually change how your muscles and joints function, leading to chronic discomfort. Lack of movement is another major factor. Sitting for long periods reduces blood flow to the muscles and causes them to tighten. Tight hip flexors and weak glutes can pull your pelvis out of alignment, increasing strain on the lower back. Many people try to solve the problem with painkillers, but medication only masks the symptoms instead of fixing the underlying issue. In some cases, back pain may also be caused by herniated discs, arthritis, osteoporosis, muscle strains, or nerve compression. Stress can make things even worse by causing muscles to stay tense throughout the day, especially around the neck, shoulders, and lower back. The good news is that most back pain can improve with regular stretching, strengthening exercises, better posture, maintaining a healthy weight, and staying physically active. However, if your pain is severe, lasts for several weeks, spreads down your leg, or is accompanied by numbness, weakness, fever, or loss of bladder or bowel control, you should seek medical attention immediately, as these symptoms may indicate a more serious condition. Understanding the real cause of your back pain is the first step toward lasting relief. Instead of simply treating the pain, focus on correcting the habits and conditions that are creating it. Why the spine is so vulnerable in modern life. The human spine evolved for movement, walking, bending, lifting, twisting, and reaching in 100 different directions throughout the day. It was never designed to stay locked in one position for 8 or more hours at a stretch. Yet that is exactly what happens to millions of people who commute by car, sit at a desk, eat lunch at that same desk, and then unwind by sitting on a couch in the evening. The spine itself is a stack of 33 vertebrae cushioned by intervertebral discs, supported by ligaments, and stabilized by layers of muscle. The deep core muscles, including the transverse abdominis, multifidus, and pelvic floor, act like an internal corset, bracing the spine from the inside out. When these muscles are strong and active, they share the load with the spine, protecting the discs and joints from excess pressure. When they are weak or switched off from disuse, the spine has to absorb forces on its own, and that is when problems begin to accumulate. This is why back pain so often develops silently over months or years rather than appearing overnight. A person might point to a single moment, bending to pick up a bag of groceries, as the cause of their pain, when in reality that moment was simply the final straw after a long period of accumulated strain. The core connection. Why weak muscles lead to pain. Your core is not just your abdominal muscles. It is a cylindrical system that includes the abdominals in front, the spinal erectors and multifidus in back, the diaphragm on top, and the pelvic floor on the bottom. Together, these muscles create intra-abdominal pressure that stabilizes the spine during virtually every movement you make, from standing up out of a chair to reaching overhead. When the core is weak, the spine loses this internal support system. Individual vertebrae can shift slightly out of their optimal position during everyday movements, placing uneven pressure on the discs and facet joints. Over time, this uneven loading can contribute to disc degeneration, joint irritation, and the kind of nagging ache that seems to come from nowhere. Weak glute muscles compound the problem. The gluteus maximus and medius are meant to be the primary movers when you walk, climb stairs, or stand up from a seated position. If they are underused, which happens easily when someone sits for most of the day, the lower back and hamstrings begin to compensate, taking on work that isn't really theirs to do. This compensation pattern is a common and often overlooked contributor to chronic lower back tightness. Posture, a slow and steady drain on the spine. Poor posture rarely causes pain immediately. Instead, it works like a slow leak. A forward head position from looking down at a phone, for example, can add significant extra load to the muscles of the neck and upper back for every inch the head moves forward from its neutral position over the shoulders. Held for a few minutes, this is harmless. Held for several hours a day, every day, it becomes a chronic source of tension. The same principle applies to slouched sitting. When the lower back loses its natural inward curve, lordosis, and rounds backward, the discs in the lumbar spine are pushed to bear pressure unevenly, with more load concentrated on the front of each disc. Over years, this altered pressure distribution has been linked to disc degeneration and bulging. Posture problems are often self-reinforcing. Tight chest and hip flexor muscles pull the body into a hunched, forward-leaning position, while the muscles that should be holding you upright, the mid-back extensors and deep neck flexors, grow weak from disuse. The result is a posture that feels normal simply because it has become the body's default, even though it is quietly working against spinal health. Sitting, the modern epidemic. Prolonged sitting deserves its own discussion because of how central it has become to daily life. Research on occupational health has repeatedly linked long periods of uninterrupted sitting with increased rates of lower back pain, independent of how physically active a person is outside of work hours. There are several reasons for this. First, sitting places roughly 40 to 90% more pressure on the lumbar discs compared to standing, depending on posture and chair support. Second, sitting shortens the hip flexor muscles over time, which can tilt the pelvis forward and increase the curve in the lower back, a posture known as anterior pelvic tilt. Third, extended stillness reduces circulation to the muscles and connective tissue, allowing them to stiffen and lose flexibility. It is worth noting that even people who exercise regularly are not immune to the effects of prolonged sitting. An hour at the gym does not fully offset 8 hours of sitting at a desk. This is why movement breaks throughout the day, standing, walking, or simply changing position every 30 to 60 minutes, are now widely recommended alongside, not instead of, structured exercise. The painkiller trap. It is completely understandable to reach for over-the-counter pain relief when your back hurts. Pain is uncomfortable, and modern life doesn't leave much room to slow down. But painkillers only address the sensation of pain, not the mechanical problem creating it. If weak glutes and a rounded sitting posture are the actual source of the strain, no amount of medication will resolve that underlying imbalance. Relying on painkillers as a long-term strategy carries its own risks, including gastrointestinal issues from frequent NSAID use and the possibility that masking pain allows a person to keep repeating the very movements or postures that caused the problem in the first place, potentially worsening the underlying issue over time. Other medical causes worth understanding: while mechanical factors, weak muscles, poor posture, and inactivity account for a large share of chronic back pain, they are not the only possible cause. It's worth understanding these other conditions so you know when your pain might need a different kind of attention. Herniated or bulging discs occur when the soft inner material of a spinal disc pushes through its tougher outer layer, sometimes pressing on nearby nerves. This can cause pain that radiates into the buttocks or leg, along with tingling or numbness. Arthritis, particularly osteoarthritis of the spine, involves the gradual breakdown of cartilage in the facet joints between vertebrae. This can lead to stiffness, reduced flexibility, and pain that is often worse in the morning or after periods of inactivity.